Hey there, and welcome back to the Nursing Research Tips podcast, where we break down the science behind the care with clarity, curiosity, and just the right touch of practicality. I'm Jenny Barrow, your host, and fellow lover of all things evidence, inquiry, and innovation in nursing. If you've been following along, you know that we've covered the foundations, what nursing research is, how it differs from evidence-based practice and quality improvement, and how each one plays a role in shaping how we provide care as nurses. But today, we're going to take a step back and ask a slightly deeper question. How do we know what we know in nursing? And why does that even matter? This episode is all about a topic called epistemology. Now, don't tune me out just yet. I promise this is not just academic philosophy stuff. Epistemology is simply the study of knowledge. Where does it come from? How do we decide what counts as good knowledge? And what does it mean to know something in the first place? Now think about this. Have you ever had a moment where you just knew something was wrong with a patient, even before the monitor started beeping, or even before lab values came back that flagged some warnings? Or maybe you've had to speak up in a huddle because your experience told you that the plan of care did not fit the situation well. That's epistemology in action, even if you didn't know the word for it. In nursing, we deal with knowledge in all kinds of forms. Research articles, clinical guidelines, your own intuition, ethical principles, lived experiences, and yes, those gut feelings. Understanding epistemology helps us reflect on all the ways we come to know what we know and how we can use that understanding to strengthen our practice, to improve communication, and ultimately to give better patient care. So in this episode, we're diving into what epistemology means in plain, simple language, how nurses use different ways of knowing, and why this matters more than ever in our complex, fast-moving healthcare environment. All right, let's get curious. Okay, so now that we've opened the door to epistemology, the study of how we know what we know, let's walk through one of the most practical and meaningful frameworks that nurses have for thinking about knowledge. It's something called Carper's 4 Ways of Knowing, and I still remember the exact moment that I was first introduced to it. It was during the first full semester of my PhD program. I was sitting in a philosophy of science course surrounded by brilliant minds when a discussion began covering the 4 categories of empirical, ethical, personal, and aesthetic knowing. And I'll be honest, I had one of those head tilting moments like, wait, why has no one ever taught me this before? I'd been a nurse for years at that point, and yet this simple breakdown suddenly makes so much sense of so many experiences that I'd had in my practice. And I would be remiss if I didn't mention that Dr. Peggy Chinn herself, yes, the Dr. Chinn, was a visiting lecturer in that very course. As someone who expanded Carper's original framework, Dr. Chinn introduced us to a 5th essential way of knowing, emancipatory knowing. So more on that in just a bit. So now let's dig through those 5 ways of knowing, 4 from Carper and 1 more recent one from Dr. Chinn. Let's talk about them, title them, and explain more about them. The first way of knowing is empirical knowing, which is the science of nursing. This is the one most people are most familiar with. Empirical knowing is the science side of nursing, the facts, the research, the evidence-based guidelines. It's what we learn from studies, textbooks, and protocols. When we say something like, the evidence shows this wound dressing reduces healing time by 40%, that's empirical knowing in action. So empirical knowing is measurable, it's testable. So it's when you chart or what shows up in policy documents. And it's essential, but it's only one way that we know things as nurses. The second way of knowing is ethical knowing, or doing what's right. As a nursing student, you likely are taking or took in the past courses pertaining to legal ethical issues in nursing. So this is not a foreign concept. Ethical knowing is our moral compass. This is about knowing what is right, fair, and just. It's not something you measure with a lab value or with a survey. It's what kicks in when you're advocating for a patient who can't speak for themselves, or deciding not to follow a routine order because it doesn't feel right for this particular person and this particular circumstance. Ethical knowing helps us to make tough calls. It's like balancing patient autonomy with safety, or deciding when to push back on an unfair policy. It's not always black and white. There's lots of gray areas. But this way of knowing is rooted in our professional values and our commitment to doing no harm. Carper's third way of knowing is personal knowing, otherwise known as the therapeutic connection. This one is so special. It's about the relationship you build with your patient and also your own self-awareness that you bring to that encounter. This is the kind of knowledge that is not written in any textbook or policy and procedure manual. It's the connection you make when a patient trusts you enough to cry with you, or when you sense that a smile and a moment of silence will bring more comfort than 1,000 words ever could. It's about being present, being human, and showing up authentically with those you're providing care for. Personal knowing reminds us that nursing is not all about tasks. It's about relationships. Carper's final way of knowing was aesthetic knowing, which is sometimes called the art of nursing. Now, this is not about painting or poetry, though those things have their place too. It's more about clinical intuition, timing, and using creativity in your practice. It's knowing how to do something in a way that just feels right. Think about when a nurse positions a dying patient's hand into their spouse's one last time, or how they adapt how they teach a new diagnosis based on the patient's preferred learning style. Aesthetic knowing is that graceful part of care, the ability to sense what is needed and tailor it precisely with empathy and finesse. Now let's go back to that fifth way of knowing that I mentioned earlier, emancipatory knowing, added by Chinn and Kramer. This one is all about seeing and challenging injustice. It's the ability to recognize patterns of inequality in healthcare and using that knowledge to change those systems. This way of knowing reminds us that nursing is not just about caring for individuals. It's about advocating for communities and transforming practice environments. It calls us to think critically, ask hard questions, and push for change when the system falls short. So to recap, empirical is our science, ethical is our sense of right and wrong, personal is about our relationship with ourselves and with others, aesthetic is that creative, intuitive flow, and emancipatory is our lens for justice and transformation within the healthcare environment. Learning all of this reshaped how I understood what it meant to be a nurse. Suddenly, knowledge wasn't just what was in research articles. It was also what I felt, what I believed, what I created, and what I questioned. Coming up next, we're going to talk about how these different ways of knowing show up in evidence-based practice. Because yes, even evidence has more layers than you might think. Okay, so let's jump back into this. So far, we've unpacked what epistemology means, and we've walked through Carper's and later Chinn's ways of knowing in nursing. Now it's time to connect those ideas to something you've probably heard a lot about, especially if you listened to some of my previous podcast episodes, and that's evidence-based practice, or EBP for short. Here's the thing. When we say evidence-based, people often jump straight to thinking about randomized controlled trials, statistical significance, and clinical practice guidelines. And yes, those things are important. But remember from past episode, EBP is not just about research. It's about how we know something works and how we decide to act on that knowledge in the real world. So let's break this down further. The classic model of EBP involves three components that we talked about in a prior episode, but I just want to recap. Those are the best available research evidence, clinical expertise, and patient preferences and values. Sometimes a fourth component is added, which is context and available resources. Again, those should sound familiar. These pieces map beautifully onto the ways of knowing that we just discussed. So empirical knowing mirrors perfectly with the best available evidence. Again, empirical knowing is the science. The science is front and center here. We use data from studies, systematic reviews, and clinical trials to inform our choices. This is the kind of knowing that most people do associate with EBP, but it can't be the only thing we rely on. We also need to take into consideration personal and ethical knowing, which corresponds to clinical judgments and patient values. Your clinical expertise, your gut instinct, your understanding of patients' unspoken needs, your experience over time, basically, that shapes how you interpret and imply the evidence. And what about the patient? They bring their own values, beliefs, and preferences. Ethical knowing reminds us to listen. Just because a study says that intervention A is most effective, that doesn't mean that it's right for every patient. Evidence-based practice demands that we consider what matters to the person in front of what matters to us. Then there's aesthetic knowing, the art of delivering care in a way that feels personalized, humane, and timely. EBP is not one size fits all. It takes creativity and sensitivity to tailor evidence to real lives in real time. And finally, emancipatory knowing reminds us that even evidence has limits. What populations were studied? Who was left out? Are there structural barriers preventing patients from accessing evidence-based care? This lens challenges us to ask, whose knowledge counts? And how can we push the system to be more equitable? So yes, evidence-based practice includes science, but it also includes ethics, experience, intuition, and justice. When we talk about using evidence, we're really saying, let's bring all of our ways of knowing to the table. That's how we make care better, smarter, more compassionate, and more responsive. Up next, we're going to take all these concepts and make them practical. Let's look at how different ways of knowing influence the kinds of questions that we ask and how we go about answering them. Now that we've explored how the various ways of knowing come together in evidence-based practice, let's take it a step further. Let's talk about how these ways of knowing influence the types of questions we ask as nurses and how that affects the kind of research we pursue. Here's a little secret I wish someone had told me about earlier in my academic career. The type of question you ask determines the type of knowledge that you seek and how you will go about finding that. And those questions, they're rooted in our ways of knowing. So for example, empirical knowing is very much connected to quantitative research questions. If you're operating primarily in the world of empirical knowing, you'll likely ask questions like, how many? How often? What is the relationship between variable X and variable Y? Does intervention A result in better outcomes than intervention B? These are the types of questions that lend themselves well to quantitative research, controlled studies, data sets, statistical analysis. Now let's say your question is rooted in personal or aesthetic knowing. Maybe you're curious about how patients experience a diagnosis or how nurses perceive moral distress in the ICU. Those kinds of questions are more about meaning, context, and lived experiences, and they often lead you to qualitative research. Think things like interviews, focus groups, and thematic analysis. But what if your question is, what should we do when two ethical principles conflict? Or how do nurses navigate patient autonomy versus patient safety? Those are questions about ethics. They may not always lead to traditional research studies, but they're crucial for theoretical exploration, ethical frameworks, and philosophical inquiry, and yes, even qualitative research. Then we have emancipatory knowing, which sparks questions like, why are certain patient populations consistently underserved and undertreated? Or what systematic barriers are preventing equitable care? These questions drive critical, participatory, or action-oriented research. They challenge norms, invite collaboration, and often call for mixed methods or community-based participatory approaches. So often, students and even seasoned nurses get caught up in choosing a method before really thinking about their question. But the question comes first, always. Ask yourself, what do I want to know? Where is that question coming from? Is it empirical, ethical, aesthetic, or personal? And then what approach would best help me answer that question? There's a beauty in recognizing that no single way of knowing or researching is superior. Each one gives us different tools to understand and care for people more holistically. As a nurse, you're constantly toggling between these ways of knowing, even if you've never labeled them that way before. You use data, instinct, compassion. You question the system. And yes, you make decisions, often without all the answers. So next time you're faced with a clinical puzzle or a practice problem, pause and ask yourself, what kind of knowing is needed here? That small moment of reflection might just lead you to the best path forward, whether that's research, evidence-based practice, quality improvement, or having a deeper philosophical conversation. And just like that, we've taken a deep, but totally approachable dive into the world of epistemology and nursing. We've looked at what it means to know something in our profession. We've explored Carper's foundational 4 ways of knowing. We've added Chinn's important expansion with emancipatory knowing and connected it all back to how we practice, teach, and research in nursing. So what do I want you to take away from today's episode? First, nurses are knowledge workers. Whether you realize it or not, you're constantly drawing on different kinds of knowledge: scientific, ethical, personal, intuitive, and social. Also, there's more than one way to know, and each of these ways is valid, valuable, and necessary in a complex, human-centered science field like nursing. And finally, your practice is shaped by your perspective. The questions you ask, the solutions you pursue, the care you give, those all stem from how you see and understand the world around you. So here's your reflection prompt as we close out today. Which way of knowing do you tend to lean on the most in your day-to-day practice? And is there another way of knowing that you would like to explore more intentionally? Maybe you're strong in empirical knowing, but you haven't thought much about the ethical implications of a new policy. Or maybe you've relied on your intuition for years, but you're ready to dive into some of the research behind why it works. Wherever you are, just know you're doing important, thoughtful work, and you're not alone in figuring it all out. Next week on Nursing Research Tips, we're going to take a step back and ask, what even is a theoretical framework? And why does every paper I read seem to have one? We'll demystify the difference between models, theories, and frameworks, and we're going to talk about how they help us organize our thinking in both research and in practice. Until then, keep asking great questions, trusting those instincts, and never stop learning. Thanks for listening. And if you found this episode helpful, share it with a friend, a student, or a colleague. Until next time.